Now let us begin with Chapter 3, Laser Safety. We start with laser safety by knowing that you have to comply with regulatory standards set by OSHA. So OSHA is the body that enforces workplace violations, and such specifically for lasers, we have to bring up the general duty clause, where it simply states that you as the employer have the obligation to protect your staff and your patients from any type of harm, and make sure you protect their safety. If not, the consequences will be about you getting fined incrementally. I believe it starts at 16,000, it goes up, and heavy penalties thereafter, and legal issues. For laser safety, we use a standard set by the American National Standards Institute, section Z136.3, which stands for Safe Use of Lasers in Healthcare. So, as users of the technology, we expect you to be compliant and always practicing what you already know and what you will learn today to prevent incidents. Our job, regardless, is to be act like a safety advocate, regardless where you are, especially when you are exposed to this type of technologies. So the first hazard that we have to focus on in pr- protecting ourselves is the protection of our eyes, especially different eye structures. So lasers can damage pose a damage either from the retina, cornea, sclera, every type of the eye, depending on the wavelength. Some wavelengths, just like the infrared, which you cannot see, it could go further out. You wouldn't know that it hit you, but your eyes will be already damaged just because you didn't protect yourself. So, for eye protection, this is what we should be looking out for. First of all, it's the optical density rating, or the OD. It starts with a plus number one up to whatever that design is. So the way it works is anything plus one is 1,000% protecting you from harmful rays generated by that specific wavelength. Now, for lens labeling, make sure that we purchase, or you're provided with a goggles that has clear labeling on it, and also the wavelength is typically inscribed on the front of the lens and also on the um, side part of the goggles. And for the fitting, make sure that when you wear it, either over your glasses like mine, or just straightly wearing it without your goggles or contacts, make sure that there are no gaps. The next hazard that laser poses is for fire safety. When you're exposed to gases and flammable chemicals and oil based, you are exposed to fire hazards. As such, we recommend that you own per treatment room a fire extinguisher rated ABC, not A, not B, not C, because the ABC should cover everything that you can be exposed to when there's a fire hazard, such as electrical fire, chemical fire, and also paper and plastic. For your drapes, make sure in your treatment area, this could catch fire very quickly. Make sure you contain them and you know where they are at all times, because we do use drapes, especially for the patient. Make sure you clean out their faces, because a lot of these, the skincare products and anything that they use to beautify themselves are probably made of oil-based chemicals or flammable liquids as well. And most importantly, for gases, especially if your treatment room uses anesthetic gases like isoflurane, sevoflurane, desflurane, nitrous oxide, oxygen. All of those are oxidizers that can cause immediate combustion. So be very careful when using it in this type of situations. The next hazard we will discuss is the plume risk. When operating lasers in an environment where you are treating a body cavity, it generates all this plume that you can inhale, and they are very unhealthy. As such, they generate viral particles. Some of them are carcinogenic or cancerous at higher levels of content, and many of them requires filtration before they're even breathed out. So for something like this, I expect each one of you to own or use a smoke evacuator with a disposable filter, because those filters get filled up and they have to be replaced approximately 2,000 hours. Next hazard is related to skin burns. So first we got the ocular, which is the eyes. For higher powered lasers like class 4, this is very possible and imminent. You will burn. You will burn someone for something as superficial erythema up to like third degree class burns. Make sure you know how to handle this, and hopefully we don't get to the point wherein we are burning them, especially like a hemorrhagic burn. And this is typically caused by electrical fires in combination with the laser. Moving forward to our laser treatment controlled area. This area is pretty much your area where you have your patients and yourself treating them. And first thing you should be setting up is your laser safety signage, that you could put it somewhere outside of the door or somewhere where it's viewable and can be seen by anyone walking around, just in case of potential accidents. At least they are reminded that there is a treatment ongoing. For door controls, majority of the lasers uses an interlock. An interlock is like a little switch that hooks up to the back of the device, and typically you hook up a harness there to hook up to the door. So what happens is when someone tries to budge in, by accident, that wire gets pulled, that interlock gets pulled from the machine, and it turns off the device. Now, for those looking for those people that are treating those with the bling bling and shiny objects, make sure you remove them prior. Also, be wary of using reflective instruments, and I would also cite your vanity mirrors there. If you can drape it when you're doing your laser treatment, and just removing it when you are done. Another hazard related to lasers is electrical fire. Anything of type of short circuit. This is not for you something to deal with. Call your biomedical service company or electrician. For cooling leaks or gas system leaks within the system, consult your service provider. My recommendation for these and for any type of hazards, make sure that you have a nice cheat sheet where it lists all of your emergency contacts, when something like this happens, you are prepared. Now, as we are close to ending this section, I want to discuss this pre-treatment checklist. And one thing that we have to focus on is skin assessment. Make sure that before treating, you assess your patients properly. If they need any clearance from their primary doctor or specialist, make sure you get that prior, so you can you can look at the full scenario in detail. For those that are using medications that will affect, like such as blood thinners and whatnot, or Accutane, make sure that you put them to a stop a couple of weeks prior to their laser treatment. And lastly, I would suggest, not suggest, I want you to perform patch test. Patch test during that time will determine if your certain settings reacts. If it's over, then you can make that decision on how to set up their treatments. Tr- Typical patch test areas could be underneath here on the chin, on the back of your arm, or on the back of your ears. Anything that's not visible that can get you in a lawsuit, in case something drastic happens, is what I recommend. Now, for post treatment, after the laser treatment, we expect you to follow your post treatment checklist. Also, make sure that if it's a very hot laser or very hot treatment, to continue cooling up to 20 to 30 minutes to prevent overheating of the epidermis and complications. Use of ointments as pretty much when the effect of the laser has stabilized or cooled. And keep in mind of the red flags. If there's something that's off, if the patient is complaining to you about something, make sure you address them. For emergency protocols, make sure that we deal with eye injury. For this, we should have like a eye faucet or eye kit. Some of them they sell this thing for the faucet where you have an adapter that you could put your head in there and just flush out the eyes. For burn management, escalate it, or call 911 if it gets to that point. Device malfunction, the moment you notice that your device is malfunctioning, you for any reason, press on this stop button and stop using the machine and call your service company immediately. And also, I expect you to write an incident report. Now, here's our final key takeaways. We have to understand wavelength. It determines so much on how you can treat and you can succeed in treating your patients. Knowing the skin type. I would say for the Fitzpatrick, so we have 1 through 6. Some of them have like mixed race. Try to know more about your patient and base it from there. So for some reason you have someone that's an example of like a skin type 3, but they look like a skin type 4, then perform the assessment and continue doing what you've learned from the previous slides about doing a test shot and adjusting as you are able to. Let's not forget our thermal relaxation time, as this will mean a difference of hurting your patient or resulting in a very successful treatment. So knowing this, commit this to memory. Just I would say, if we use the example for hair removal, anything between 30 to 100 milliseconds. If you are within that range, not over that, then you should be good. And lastly, I expect all of you to practice safety. Wherever you are, when you're using technology, always make it a standard practice. Keep in mind, we are all safety advocates. We all work in healthcare. It is our duty to make sure that no one gets hurt. So this will wrap up my presentation. I thank you very much. We are now open for question and answer section. Thank you.